Hello, in this video, I want to introduce the glucometer. Glucometer is a medical device used to check one's blood sugar. Checking blood sugars is really important when you live with diabetes and or taking medications that may affect your blood sugars. So in this video, we'll go through a glucometer together, and I'll provide you with some tips and tricks you can use to instruct your patients. Okay, so I have with me today a very generic meter. You can get this meter at really any pharmacy. The brand is One Touch. Most meters are quite similar at the pharmacy. They have all of the same parts and pieces. So we have the glucometer or the meter here, the lancing device, a canister of testing strips. I have some alcohol prep pads because we'll want to cleanse the finger before doing the check. And then I have a little bag of lancets. And so normally the lancets and the strips would come as separate prescriptions, but the kit does include a few to get us started. So in order to gather a specimen from the finger, we'll need to insert a lancet into the lancing device. And there's a lot of different styles of lancing devices. They're all a little different, but in this one, we're going to untwist the top, and you'll take the lancet and insert it into the end, and you'll twist off the plastic cap to expose the little tiny needle. So we'll attach the lid back on the device. And at the end of the lancing device, there's a dial, and the dial is used to set the depth. For myself, I usually use like a 5. So that's anywhere between a 1 and a 7. The first time you instruct a patient on turning on a glucometer, you will need to help them set the date and time. In our canister is our strips. So we'll need 1 strip for this test. They are very tiny. They do require good dexterity. Okay, so in order to activate the glucometer, you're going to insert the strip into the top of the device, and it should turn on, wake up, and indicate that it's ready for a specimen. So this is an area where some folks can run into issues, because if they don't put the specimen on the strip fast enough, it can time out and go to sleep and then cause an error and frustrations. So I think what I'll do is I'm going to pull it out to help it go back to sleep, give myself a little more time to poke my finger and get a specimen. So because I'm not washing my hands before checking, I am going to use an alcohol wipe. We're just going to cleanse a little part of the finger. Really anywhere on the sides of the fingers are good areas to draw blood. You don't want to do it right in the center where you're going to pick something up. It's a little more sensitive. So I'm going to wipe and just clean off any lotions or juice or any fruit I may have eaten earlier in the day. For my lancing device, I'm going to draw back on this lever here in order to give it some spring. And then I'm going to hold it up against my finger as such. And when I'm ready, I'm going to press the green button. And I'll hear a click, which I did. And I'm going to just apply a little bit of pressure. Sometimes if it's hard to get blood, folks might be cold, or maybe they didn't drink enough fluids that morning. They may be a little dehydrated. Now I'm going to push my strip back into the glucometer in order to encourage it to wake up. And it looks like it's ready. So I'm going to turn this towards me, and I'm going to vacuum it up so the blood sample actually goes inside the strip, not on top, not underneath, but inside. And it looks like my blood sugar is 75, so it might be time for lunch. But Yeah, so generally folks should get a reading pretty quickly. Common errors, again, might be that they didn't get enough of a blood sample, that the strip wasn't inserted correctly. They may have used expired strip, lots of different reasons. So if you have questions or concerns, reach out to me. I'm happy to chat more about glucometers.